Our nation is experiencing a dangerous shortage of mental health professionals. Many times when seeking help, East Texans are left with more questions than answers. Now, Fox 51 Good Day anchor Raina Revel has more in this fourth part of a breakdown of mental health in East Texas.
Our nation is currently experiencing a shortage of mental health professionals, leaving many who desperately need support in the cold.
As far as psychiatrists, we have a psychiatrist that specializes in treating children and adolescents. So with her, the current waiting list ranges from 2 to 4 months.
A recent Harvard University study found that only 17% of phone calls to make an appointment with a mental health professional were successful. Many are still left frustrated, fighting to help their children's mental well-being.
At first, it was a long time. Just trying to get a diagnosis was difficult, trying to find someone who could provide a diagnosis. And so we saw a series of doctors.
Parents like David were able to take advantage of federally funded school programs like Care Solace at Henderson ISD.
The mental health side, the demand apparently is so high that we were waiting months before we could see a doctor or to get a diagnosis to say, hey, what's going on? Now, the school was working real closely with us, and they were providing counselors for us. We were able to find someone in our community who was willing to provide counseling or to help out with counseling as well.
Checking in with your local school services can help families get in touch with the right resource at an affordable cost.
More than 2/3 of our district is classified as economically disadvantaged, which just means they don't always have the money resources that they need.
Nationwide, we are also currently 6.4% short of the psychiatrists needed. By 2025, the expected demand will top 60,000 and a need of more than 15,000 professionals.
I think unfortunately many mental health providers in the area do have waiting lists. Depending on a person's need, at Mosaic you may be able to get in tomorrow, and it may be a number of weeks or even a couple of months depending on how specific your needs are. And I think that's probably the case throughout the community.
According to the Association of American Medical Colleges, nearly 60% of psychiatrists are 55 or older, and for many, the field of mental health is not a profitable one.
I think things are better than they were 5 years ago. There's more psychiatry accessibility, but we're trying to make up the difference in what's been a pretty significant problem for a long time.
Helping remind those in need that help is out there and they are never alone. Raina Revel, Fox 51 News.
This is the fourth of 5 stories on the state of mental health and its access here in East Texas. Join us tomorrow on Fox 51 News at 9 as we focus on the shortage of mental health care providers and resources here at home. And if you or someone you know is having trouble with anxiety and depression, it's recommended to speak with your healthcare provider. If you're in a crisis, you're urged to dial 988. We also have help over on our website. That's fox51.com.